At the 2005 commencement speech, Steve Jobs said, "Innovation is the ability to see change as an opportunity and not a threat." This quote goes well with my presentation because we know creators like and founders like William Rodigan and Marie Curie, they were innovators in the field. They found their findings and they were able to share and willing to share to make radiation what we know it as today. My 3 points are the origins of radiation therapy, who needs radiation therapy, and what is the purpose. The origins of radiation therapy came about in 1865 when William Rodigan, a physicist, discovered cathode X-rays and their electromagnetic material. Radiation therapy would be needed by cancer patients who are looking for treatments in order to shrink and rid of cancer cells. And that goes along with the purpose as well. Radiation therapy is to shrink and get rid of cancer cells so that they don't come back. According to National Institute, 50% of patients who have cancer receive radiation therapy as a treatment or part of their treatment. And this is simply saying that 50% of the cancer patients who are diagnosed with cancer receive radiation therapy as part of their treatment. It could go along with many other therapies such as chemotherapy, as well as any other medication that the doctor may prescribe, but they also may just receive radiation therapy as their solo treatment for the time being or permanently. My name is Alexis Cantrell, and I discovered radiologic technology in my search for a career in healthcare. I knew that I didn't want to do anything too hands-on in a way, and I found radiologic technology, and this was perfect for me because I got to socialize and make conversations. I found that I would be able to do patient interaction, but it also had that tech side that I really was interested in. I was able to research radiation therapy, and in the sources that I found and information that I found from websites such as American Cancer Society and nationalinstitute.org, I will present to you the most updated information that I have found. So I'll be talking about the origins of radiation therapy, the different types of radiation therapy, and the possible pros and the possible side effects. First, I'll be talking about the origins, where it came from. Secondly, I'll be talking about the different types that have come about since that day in 1865 when Wilhelm discovered radiation as a whole. And then I'll be talking about the potential side effects and cons that could come from, and the pros that could come from radiation therapy. In 1865, Wilhelm Röntgen, who was a physician, discovered X-rays. He was experimenting with cathode rays, which are the negative components of X-rays, and he was able to find that the electromagnetic radiation could penetrate human skin. He discovered this on his wife. He used his wife's hand as an example. And in 1896, Marie Curie discovered 2 highly radioactive materials that could be used to treat cancer. She discovered polonium and radium. She discovered that radium destroys diseased cancer cells while protecting healthy tissue. Next, I will be talking about the different types of radiation. From 1865 to 1896, doctors were able to catapult into the experience of medical imaging as well as the ways of treating cancer, and they were able to come up with different therapies and different treatments to rid cancer fully. Marie Curie and William Röntgen were really pioneers in this field, and they set a laying ground for doctors today. The first form of therapy I would like to talk about is external beam radiation. And external beam radiation uses high energy beams similar to X-rays to target cancer cells. You would go A patient will go typically several sessions to target that cell, but also prevent damage to the healthy cells. And because this is a high energy beam, it's also highly radioactive, so we want to spread it out through multiple sessions to keep as much healthy tissue as possible. These types of therapies you would go if you have breast cancer or if you have lung cancer. Next is internal radiation therapy, and this is the usage of highly radioactive material. It is extensioned into the tumor cell. This would be used for prostate or cervical cancer. So this is a therapy that is inserted into where the cell is. You will go internally instead of externally, like a CT machine or a MRI machine. This is an internal procedure. Lastly, I will talk about stereotactic radiation, which is a radiation therapy that targets tumor with high radiation dosages, specifically to that specific area. And this would be more so for small areas such as the brain as well as the lung, where you really need that precision to target these cells to minimize the damage to the healthy cells around it. Concluding, I would like to go over what I would like to go over the pros and cons of radiation therapy. Pros would be the complete riddance of any tumor or cancer cells, as radiation therapy is powerful, and as long as there's other methods with the radiation that are paired with the radiation, there is a possibility of a complete 100% riddance of any tumor cells. You will go into remission, meaning you would be 100% cancer free. The adverse side effect would be that there is a possibility of post-secondary cancers. There is local reoccurrence and distal abilities of cancers to show back up. Local meaning that a cancer would show up close to an area where a cancer was prior, meaning that the tumor cells didn't fully get rid of. Reoccurrence would mean that, similar to local, that the exact, but this would be in the exact same area, and that the tumor cells weren't fully eradicated. And then you have distal. Distal would mean that there would be a tumor that appeared far from where the original tumor was that was rid of. So for example, it could be in the brain, and then there could be a possibility of prostate cancer occurring. In conclusion, I would like to talk about what I went over. I talked about the beginning of radiation and how it was discovered by William Röntgen and pioneered as well by Marie Curie in 1865 and in 1896. And that led to the launch and the advancements over the years, such as the therapies that I've discussed today. External beam radiation therapy, as well as internal radiation therapy and stereotactic radiation therapy. These are all new therapies that medical professionals and doctors have come up with to beat and eradicate cancer. The quote from one of Adore Civitic's TED Talks would be, "The first thing anyone can do about an issue is get informed." Staying informed is so important because we have family and friends and people around us who may have experienced cancer, and who we need to know how to be best suitable for them. We need to know how to comfort them and cater to them. We also need to know how to be an advocate on their behalf. So staying up to date on what is going on in the field of radiation therapy is so beneficial to people around you, to your friends and your families and your loved ones who unfortunately would have to experience this, you can know how to best advocate for them. I would like to leave you today with the definition of what radiation therapy is, as well as knowing that advocacy is a big step in knowing what radiation therapy is and knowing the different therapies and the types. I talked about the origins of radiation therapy, and I hope I was able to be beneficial to you guys. Thank you.